Good morning, everyone, and welcome to the Innovation Gateway session. I am Peggy Barter-Strite, and I'm the Technology Partnership Director at HDR UK. Together with my colleague Sushil Verma, our Engineering Director, we're responsible for the development of the Innovation Gateway. Caroline already introduced it this morning, but we're going to give you a quick background, breakthrough, and live demo of what we're going to do today. Next slide, please. So we'll start with a quick introduction, the journey so far, the key highlight, then the live demo focusing especially on what we've heard today to the pain point, which is requesting access to data sets. Then we'll follow with what's in store, and we'll open up the floor to questions after that. Next slide, please. Now, I've been told that a picture is worth 1,000 words. So instead of a picture, we're going to start with a quick video.
At Health Data Research UK, we passionately believe that health data innovation has the power to change the world, now more so than ever. However, finding high-quality health data for innovation is complex and difficult. Data is spread out and fragmented, held separately by thousands of organisations. And as health data is highly sensitive, ensuring safe and secure access to guard against misuse can be a time-consuming process. The whole system can appear opaque to outsiders, and people are rightly interested in what's happening to their health data. This lack of clarity is stifling innovation, and we at Health Data Research UK want to challenge this status quo. We want innovators and researchers to be able to easily discover health data resources that are so vital for their research. So, alongside our partners, with support from our funders and help from patient and public representatives, we are building a UK-wide network that helps innovators get safe and efficient access to a huge array of health data and resources. To lead this, we created the Innovation Gateway. This technology platform brings together the information that explains what datasets are available, what they are used for, how they are structured, linked and accessed, and provides tools to analyse them. It facilitates discovery, shortens access times, and promotes analysis in safe and secure environments. All this through a transparent system that has been built with input from patients and the public. The Innovation Gateway frees up time for innovators and researchers, enabling them to concentrate on analysing health data to create life-changing solutions. Like finding more precise cancer treatments, understanding the spread of COVID-19, or even exploring why patients respond differently to different treatments. We're just at the start of our journey. But together, we can ensure better research and health outcomes for generations to come.
The Gateway is key to uniting the UK's health data to enable discovery that improves people's life. It's a program that started at the end of last year, about a year ago. We started with a minimum viable program that we launched in February. And then from then, with our partnership, technology partnership, PA Consulting, we have been since May delivering the new Innovation Gateway. Next slide, please. And we've been delivering it at, next slide, please. And we've been delivering it at pace. We've been loading it with content, and in about 7 months, we created an engaging platform loaded with datasets, tools, projects, papers, courses. It's a really rich platform, and there is so much content that we've also created something called collections to enable us to facilitate the discovery of the contents that are on the gateway. So if you think about it, a collection is a place where you can store all of contents that fall under the same topic and is discovery of those topics. So Sushil will show that to you in the demo in a little bit. But if I give you an example of how we're using the gateway to help with the national core studies. Next slide, please. So as Caroline mentioned in her introduction, the National Core Study is a really key program for us. There are 6 national core studies underpinned by data and connectivity. One were led by HDI UK and ONS in partnerships. And it's key to have the data, the COVID-19 data, discoverable and findable and easily accessible in a safe and secure manner, to have all of the data interoperable and reusable, so following the FAIR models, and to have this in a single shop window. So what we have done with the Innovation Gateway is we have created collections for all 6 national core studies. So for example, if you are interested in immunity, you can go to the immunity collection, find all of the assets, the tools, the papers, the project, the data, and go there and see if there is anything that is relevant for your particular project. And then you can request access also through the Innovation Gateway. And we're very proud to release our new data access request workflow based on the ONS 5 safes that Sushil will be demonstrating now in his live demo. So Sushil, over to you.
Thanks, Peggy. So I'm going to pray to the technical demo gods. I'm going to try and do a live demo of the Innovation Gateway. So hopefully you can see my screen. So if you go to healthDataGateway.org today, this is the screen that you will see. You will see we are completely transparent about the number of data assets we hold and the number of users who are using it and the number of searches we have in the last months. Presumably this is because of the Alliance Symposium. The numbers have gone up since Caroline's talk earlier this morning. So we have a bunch of resources around having latest news about all the innovations we're adding to the gateway. We're releasing this on a monthly cycle. We have collections of content. So as Peggy mentioned, the COVID-19 National Study collection is here. One example of the content, and I wanted to spend some time a little bit here on what a collection would look like. So essentially it's a collection of resources that you group together for yourself on the gateway. So this could include tools, data sets, projects, papers, and even people. And I want to quickly show you one of the innovations we've added to the gateway today. So I'm going to pick on one of the test data sets we have, which is HDA UK papers and preprints, which is the collection, which is a daily scrape of all the papers HDA UK affiliated members are publishing at EuroPMC and PubMed Central. As you can see, there's a high-level description of what the data set is, what the details about in terms of metadata, the coverage, format, and standards. And this would be similar to other data sets on the gateway as well. You can see the quality score for the data set. So this is actively being calculated every day so that we can measure how these data sets improve in terms of scale. You can also see the technical details for data sets. So schema level information about what the fields are and the data types that's available. So to access request to this data set, you click on how to request access. You'll be given a guidance about how the process to request access, how to submit applications, how do you do information governance, and finally, how would you control and the costs for data access requests. In this case, there's an open data set, but I'm using this as a test to show the 5 stages model. So you click on request access. I forgot to mention, you can also message the data custodian themselves. So even before you make an access request, you can talk to the data custodian and they'll be able to respond to your queries. So you fill in the form. So as you can see on the left-hand side, there's 5 sections here, and each section is dedicated to, say, each of the different sections we want to pull out from the researchers so that the data custodian can make an informed decision about your project. So you fill in safe people, safe project, safe data, safe settings, safe outputs, and you can also add in additional files. Now, this is one that I pre-prepared earlier. I didn't want to spend time trying to fill out a form live, but as an example, I can fill in details. So I'm just going to fill in Peggy's information here. out properly live. And HDA UK. And I can say, oh, oop, suddenly something went wrong. Apologies for that. If I go back to my data access requests. So you can see, even if something goes wrong, you can always get back to your data set, your application if you want to. So say people fill in Peggy's details here. And HDI UK. And then I hit submit application. Actually, I can't because it actually says there's a validation issue here. So what have I missed? It says, okay, I need to submit HDA UK as an organization name. I hit submit application. This is now submitted and it goes into your data application. So this is one that's been submitted. And now an email is sent to the reviewer, to the data custodian, and to myself as a copy, so that they can evaluate the application and then finally make a decision on your application. So I'm going to stop sharing and I'll just head back to the slides. So there's a very quick whirlwind tour of a data access request. I'll come back to the slides. So some of you, whilst the slides are being loaded, some of you might be thinking, well, what's the innovation here? This is just form that we fill in day out. One of the things we've done is align the form that we have to the data custodian. So it's the same form that you can use, or very similar to each of the data custodians, so we can have a harmonized approach to access multiple data custodians. So in our first release, 6 of the data custodians we have is supporting the 5 saves form. Next slide. So I just want to give you a very quick overview of what's coming in the future. So we've focused on discovery and access. The next phase of our work is around federation. So this is doing federated identity brokerage. So data custodians know who you are as you move along in the federated ecosystem, having federated metadata catalog. So the gateway is just a gateway to resources within the HDA UK ecosystem, doing cohort discovery. So being able to discover cohorts at scale across the trusted research environments, doing synthetic data and other key features to perform your analysis in a federated manner. Next slide. So we're doing this at pace. We're doing this on a monthly release cycle. So it's not, you don't see us for the next 6 months and we pop up with all these features. We're working with the researchers, the trusted research environment community, and the public innovation advisory boards to build these features on a monthly release cycle, and we'll be releasing that on a monthly basis. Next slide. So by the end of April 2021, we would have been doing a lot of discovery work, so improving the metadata quality and improving access to those data sets through the 5-stage form. But now we're also going to be building analysis capabilities. So core discovery is one big piece, doing synthetic data and sample data, and integrating with trusted research environments. And finally, being able to build communities around key assets so that the community can improve their own spaces, because they're the experts, and we want to empower the experts to build out niche communities around different parts of the healthcare domain. Next slide. So to close, this is my last slide. Please go ahead and register on the Health Data Gateway. You can use your Google, LinkedIn, or even your institutional accounts supported by Open Athens. Please browse the Gateway collection, the Welcome to the Gateway collection, so you can get started. There are how-to videos there, and there are test data sets you can apply for. So please use the test data sets as much as you want, so you can see the form live. Thank you, and I'll stop and we'll take some questions.
Thanks, Ishil. Please feel free to ask questions in the Q&A. We've got a couple of questions already. So the first one is, how is the data set delivered or accessed after successful access requests?
I can take this one. So right now, the data sets usually go through a form of a data release register. So data sets are released. But one of the things we're improving as part of this work is the data will be deposited within a trusted research environment. So there's a data center dedicated with a secure perimeter that you can go in and be able to access that data and analyze the data. So the data won't be sent to the user, which is what we want to prevent because there's a potential for information leakage. So the data will be stored securely in a data center, co-located with the data custodian, so you can perform your analysis there. But there's a various mixture of models that we support within HDA UK, and we encourage people to use the most secure mechanism to deliver data set. Not that none of them are secure, but that is the most secure, and we want to encourage people to go to that.
Thank you. Then there is a question from Georgina about that we get asked all the time, which is how long does it take to get access approved on average? I mean, it depends on this one. So on the data sets, the metadata on the data sets on the gateway, you will have an indication of how long it should take to get access to the data, but that it really depends on the data custodians. So I can't give you a definite answer on that. Another question was, are the data provided in a common data model, example, OHDSI or OMOP?
So that's a really good question. Again, the answer, it depends. Various data custodians use different data models, and one of the things we're doing with our improving part of our HDA UK strategy is to collate all of the different standards that's being used, so OMOP, I2P2, FHIR, and so on, and then try and harmonize that. We're working with the Phenomics team as well, led by Spiros and Emily, to try and pull together phenotypes, shared phenotypes that can be reused in multiple environments. So phenotype is just a collection of ontology terms that are clustered together. For example, asthma will use these ICD-10 codes. But again, this is a space we need to improve on. But right now we support all of the data models that the data custodian provides, and we're working with the data custodians and the researchers to try and harmonize that as much as possible.
We're running out of time. I've been told that we need to move on to the lightning talk, but any question we haven't answered, we will try to answer during the day, or we will post the answer when we submit the transcripts for today's. But thank you very much for all of your questions, and I am now going to move to the next part of the session, which is the lightning talks.